But nowadays, diabetes, we have to think.
Of today's session, Dr. Nabila. She is a medical professional and an international graduate in public health. Upon completing of ITMD bridging program from Ryerson University in April 2019, she worked as a research intern at St. Michael Hospital. She is a diligent and dedicated professional who brings a strong working knowledge of the medical environment as well as a public health lens into her work. Her research interest revolves around looking into an intersectional lens among the marginalized population and maternal health. She aims to see herself grows within the non-clinical sector here in Canada. Currently, Nabila is a graduate student of Master of Science in Community Health at Dalalana School of Public Health, where she building herself in the field of research and science. She is also an active president of a Scarborough Global Doctors Lions Club and passionately work with Diabetes Awareness Committee towards diabetes health promotion within the community. Nabila always approaches challenges with a can-do attitude and bears the ability to succeed both independently and alongside a team. Nabila, the floor is yours now. You can start.
Thank
Thank you.
you. Thank you, Mithila, for the generous introduction. So I'll be sharing my screen now. Let me know if everybody can see well.
Yes.
All
Yes.
right. So thank you. Thank you again for that introduction. And thank you, Dr. Lion Shafi, for giving us this opportunity. Last 8 months have been a very great journey with the Diabetes Awareness Seminar Series. And we young physicians had this privilege to share a range of topics on diabetes. And the last two presenters did a very nice job touching upon the new aspects of diabetes. Me, myself, coming from a research background, would like to switch the gear to the scientific aspect. So please stay and bear with me as I explore the evidence-based research. And yeah, feel free to stop me anytime if you have any questions or just type in the chat. Agafai will help me to regulate that. So, so once a person is diagnosed with diabetes, type 1 or type 2, the worry begins. How long will I live? The life expectancy starts to begin, like that starts to think how long will they live? And death is never a pleasant experience, but it's human nature to know how long can I expect to live. So I'm just going to take a brief pause here and do a quick poll and see what my audience think about life expectancy for someone living with diabetes. So I'll be launching a poll and feel free. Um, can everybody see the poll? Uh, okay,
Voting. Okay.
yeah, voting I guess have started. So please feel free to type. And if you're not sure, you can anytime type not sure. Maybe I'll give a couple more seconds and then we can stop polling and see what people have pressed. And oh yeah, it is anatomist. So feel free to type your answers and not get judgmental. Okay, so I'll stop the polling now and share the results. Like if everybody can see, like mostly have 42% have said 10 years and less, and many are not sure. Some said not reduce at all. Absolutely. So I'll stop sharing. And yeah, so absolutely. There is no hard and fast answer to this question, how long can I expect to live? So there are a number of factors that influence one's life expectancy. The sooner the diabetes is diagnosed, the sooner the person learns to adapt, the sooner his lifestyles get better, the prognosis of living longer gets better. So going to the next slide. So now I'm going to talk briefly about how research and science have taken roles in shaping diabetes since it was identified in early 1500 BC. So diabetes discovery have dated way back. In 600 BC, physicians recorded that ants were attracted to sugar patients' urine. During the Middle Age, doctors used urine flavored chart, the one you can see, the circular chart, that's called the urine flavored chart. So they used this chart to diagnose medical conditions. The one disease that they diagnosed correctly was diabetes because of the sweet taste of the patient's urine. And then in 1921, there was a revolutionary invention of insulin discovered by Sir Frederick at our own University of Toronto. So before 1921, it was unexceptional for people with type 1 diabetes to live more than a year or two. And until today, this is the only effective treatment for people with type 1 diabetes. Then in 1964, a company called the Ames used the urine test, refined it, and by 1970, they came up with the first glucometer. The picture you can see with the square glucometer. So that's the first glucometer they invented. And then it took another decade for it before it became an easy to use home glucometers. And by 21st century, we now have the needleless glucometer available. Isn't it amazing to see how much science and research have evolved over time? So getting to the key question of today's topic, does diabetes reduce life expectancy? What does research have to say about it? So learning the life expectancy has been an area of research interest since long time. So this paper I quoted here, it dates back to 1977. So the authors here tried to plot a life expectancy bar graph of diabetic patients age-wise from before insulin era and after insulin era. So I'll show you the graph. So this is how the graph look like. The bar graphs, you can see the black bars are before the insulin era and the gray bars are after the discovery. You can see how life expectancy have increased with the discovery of insulin. However, this increase is much greater in younger age compared to those 50 and above. So I just want to pause here and ask my audience, why do you think of this variation? If anybody, feel free to jump and answer me. Like, why do you think the bar has been so different for age groups?
Sorry, Nabila, I did not get your question. What was the
Oh,
question?
okay, I'll repeat that. So the question is, the bars in this graph, the black bars are the before insulin discovery. The life expectancy before insulin discovery for younger age was 1.3, 2.6. Then for age 30 and 50. And then after insulin discovery, the gray bars have increased the life expectancy. But you can see for younger age, like at age 10, the bars are so high, the expectancy have increased like triple or 4 time folds. But in age 50, it hasn't increased much. So do you know why is this happening?
Uh, Maybe the younger population, they died because of the complications, and the older population, they might have some kind of like, what do you say, immunity against of it.
That's a nice
I
answer,
think
but I won't say it's the right one.
Lion Douglas would like to say something.
I have some people raised hands.
Douglas, you have to unmute, please. Douglas, you have to unmute, please. Okay, we can go to the Elahe.
Hello, everybody. Thank you, Nabila, for the very interesting topic. I think that at the age 10, most of the diabetes is type 1. Because of that, maybe the insulin is the most impact for the life expectancy. Is my opinion. Thank you.
Absolutely right, Elahi. That's the right answer.
Thank you.
Because
Lion Paul would like to add something. Lion Paul.
Um,
Give other people chance, yeah.
Hi, thank you. Lion Paul from Huttonville.
Hello.
Lion Club.
Yes, Paul, go ahead.
Very interesting topic and conversation. I think also as maybe more people are getting educated on this diabetes knowledge, and I think there's more awareness, so the life expectancy is improving. Thank you.
Thank you, Paul. But we are talking here about like 19, like you can see in the graph, it's about 1897 and the eras of early 90s. So that time the education was not much. But like as Elahi said, that was a very right answer. That type 1 diabetes occurs in younger patients, and it is an autoimmune disorder where they do not have insulin producing cells. The insulin producing cells are the pancreatic beta cells. They're destroyed by the immune system, so the body needs external insulin to survive. So previously, before insulin discovery, children used to basically die within 1 to 2 months, and after insulin discovery, that was when the children started having a greater life expectancy. But in type 2 diabetes, which occurs in old age, they don't actually require insulin. It is not insulin dependent. There are other factors that can control the diabetes in the older age. So this was the actual reason why before insulin era, the graph was so low, and after insulin era, the life expectancy have increased so much. And absolutely today we have this answer because back then there was no answer. People knew there was diabetes, but they didn't know there were two types of diabetes. So obviously this was a curiosity, like how it generated our curiosity that why the graph have increased so much. So back then there was this curiosity, why this graph is so much. So just to get over this curiosity, another great researcher named Sir Harold Hemsworth in 1936, he developed an experiment which helped us to distinguish the two types of diabetic patients. So I'll not get more details like what was his experiment. I have his paper in the reference if anybody wants to go through. But just the results of his experiments found that the type 1 and type 2 diabetes, like he didn't name the type 1, type 2, but he named them as insulin sensitive type, like you can see in the summary, the highlighted insulin sensitive type and the other insulin insensitive type. And he said that there is an unknown factor, which he didn't know at that time, that sensitizes the body to insulin. So that was an interesting discovery as well. And till today, we distinguish these two forms of diabetes. So now I would like to go to the next question. Does people with type 1 diabetes have shorter life expectancy? So while major advances in treatments of type 1 diabetes have occurred in past 3 decades, type 1 diabetes has historically been associated with significantly reducing life expectancy. Thus, to examine the life expectancy in the people with or without type 1 diabetes, Scotland researchers did a 3-year cohort study and reported that life expectancy at age of 20 years is approximately 11 years less 11 years less for men and 13 less for women compared to the general population. So with general population, and this shows that even the patient with type 1 diabetes who still had good, there is no cure. Sorry, I'm so sorry. I'm sorry, yeah, so, oh yes. So as I was saying, in 3 years cohort study and reported the life expectancy at age 20 years is approximately 11 years less than man and 13 years less for women compared to the general population. This study also showed that even patients with type 1 diabetes who still had good kidney function had reduced life expectancy. So this was a study of this was the Scottish study which I highlighted. So another, I want to share with you 2 more studies that in a separate study at an average of 27 years of follow-up with patients of type 1 diabetes, 6.5 years of initial intensive diabetes therapy was associated with modestly increase in life expectancy and all the causes compared to the conventional therapy. So they said that there was more like intensive treatment was better than the conventional. So intensive insulin therapy, they meant is like a tight blood sugar control, closely monitoring blood sugar, using multiple doses of insulin and keeping track of food and exercise. And the conventional type is basically injecting the long-acting insulin that works for at least a day. And the second study, which I highlighted here, is what it says that while the longevity of those type 1 diabetes has improved considerably over the past centuries, this patient remains with the reduced life expectancy compared to non-diabetic population. Nevertheless, a subgroup of these individuals may survive into older age despite their diabetes. Certain clinical and biochemical features can identify these people. This understanding may provide clinicians with further evidence that correction of modifying risk factors like glycemic control, blood sugar, avoidance of excessive weight gain, and lipid control is vital in ensuring the ongoing longevity of patients with type 1 diabetes. So these are some of the studies I highlighted about life expectancy in type 1. So coming to the next question, does type 2 diabetes shorten your life expectancy? Well, research finds that there is substantial variation in life expectancy among people with type 2 diabetes, depending on their level of commonly measured risk factors such as HbA1C and as well as the duration of diabetes across different age groups. And the estimated age-specific life expectancy for men with type 2 diabetes varies between 13 years to 21.1 years. So the range of estimated life expectancy is wide, depending on the person's age, lifestyle factors, and treatment. For example, if a person does not manage the glucose level effectively, who smokes, who does not exercise, likely to have a shorter life expectancy than a person with healthful, active lifestyle who does not smoke and maintain the stable blood glucose. So it is very important that we make healthful choices, lifestyle choices to go a long way and live longer. So yes, there is no cure. Absolutely, there is no cure, but scientists are working very hard to make a groundbreaking invention so we can conquer diabetes someday. Some of the most recent advances of diabetes care includes innovation towards bionic pancreas, or also known as artificial pancreas. Then there is stem cell therapy, then intervention targeting intestinal microbiome, and then there's development of artificial pancreas device system, discovery of druggable insulin inhibitor called Inceptor. So if anybody is curious to know what is the artificial pancreas device system, I'll just shortly say that it does not involve any tissue or organ. It is a kind of a continuous glucose monitoring system that works through a tiny sensor which is inserted into your skin, usually in your belly or arm. And the sensor measures your intestinal glucose level, which is the glucose found in the fluid between the cell. And the sensor then tests the glucose every minute, and it wirelessly sends information to the monitor. So with science as its speed in development, I'm very hopeful. Diabetes will be curable and we won't have to worry losing life to it someday. So thank you for your time and patience. Please feel free to reach out to me. That's my email address given there, and I have my references for you. Thank you again.